Good morning. So I am already admitted inside the hospital because tomorrow will be my scheduled mastectomy. So I was diagnosed with invasive mammary carcinoma, and the size of my tumor or breast mass is already 2.2 centimeters. So tomorrow will be my mastectomy, and my right breast will be removed. Okay, so how am I feeling right now? I just learned to accept it, and that my worries is only the pain, basically the pain and the cost of the operation. So that's basically my first two worries. And third, right now I am praying that hopefully only the sentinel lymph nodes will be removed and the auxiliary lymph nodes will not be removed, because the doctor said that if there is a need for my axillary lymph nodes to be removed, then what will happen is that there is a high probability that in the future my right arm will become bigger, will become bigger than my left arm, because since the lymph nodes in my right arm are already removed, so the fluids will get stuck, and I should not get wounded or injected in my right arm, because it is already very conducive to infections, because your lymph nodes are already removed. So hopefully only my sentinel lymph nodes will be removed, and hopefully the cancer cells have not yet spread to my to my auxiliary lymph nodes. So to give you a brief history of my breast cancer, so early 2021 or maybe late 2020, I already touched or already noticed a lump inside my breast, and I thought it will just be gone, but later on it was still not gone. So I decided to go to the doctor, but doctor, not really a surgeon, but just an internal medicine doctor or a general doctor, and she told me to get an ultrasound and a mammogram for my breast. So by then I was already, I think, 34 years old at that time, and the results of my ultrasound in 2021 is hypoechoic solid nodule in the right breast. Consider fibroadenoma, so BI-RADS category 2 benign findings, so unremarkable sonogram of the left breast and both axillary regions. And for my mammogram, the result was BI-RADS category 3, so probably benign, dense breast with an equal density mass on the right, measuring 1.5 centimeter in diameter. So the recommendation is that 6 months short interval follow up by ultrasound. Okay, so that this was in November 2021, although I already felt the lump early 2021 or even as early as late 2020. And then things happened, I got relaxed. I took for granted the lump because from what I read from the ultrasound, it is probably benign anyway, so I just forgot all about it. And then in January this year, January 2023, my husband had a high blood pressure, so since I went with him to the doctor, so I also thought that might as well just ask the doctor about the lump in my breast, so about the mass in my breast. So this new doctor, she's a surgeon, so she sent me to she asked me to get an ultrasound at the women's center. She said that this ultrasound is more expensive, but they have a more high-tech ultrasound than the rest, so to be able to really tell if the mass is really cancerous. But she said that anyway, the lumps in the breast usually pop out every now and then, but there is really most of the time there really is nothing to be worried about, because it's probably just due to the hormones. So I got an ultrasound, and unfortunately now Biopsy 4A. So the ultrasound said, because they also found 2 lumps on my left breast. But for my right breast, it's stated here inhomogeneous solid mass, right? Tissue correlation suggested. Percutaneous core needle biopsy may be done under sonographic guidance. So it's already Biopsy 4A. So as you can see, Biopsy 4 means that there is a suspicious abnormality and biopsy should be considered. Okay, so when my doctor saw this, it's already Biopsy 4A, and she said it already means that there is already a little chance of cancer, that the mass is going to be or is cancerous. So she told me, she referred me to a certain doctor who will conduct the core needle biopsy. And for my core needle biopsy, it's stated here. So core biopsy, a typical proliferative breast lesion with features of ductal carcinoma in situ and area suspicious for invasion. Papillary lesion with a typical ductal hyperplasia and florid adenosis. Okay, so that's the result of the first biopsy result. So I showed it to my surgeon, and she told me that we need to schedule already for mastectomy, especially since there are areas suspicious for invasion already. So she said that the difference between lumpectomy is that I have to undergo radiation, and mastectomy, there is no more need for me to undergo radiation, although chemotherapy is probable whether or not I am going to have a mastectomy, or I will just choose lumpectomy. Okay, so after that, I went to a second doctor to consult about the result, and the second doctor told me that it's still a typical proliferative breast lesion with features of ductal carcinoma in situ. So because of the word features, he said that he is not, for him it's not really conclusive that it's cancer. So he wants me to undergo a third biopsy wherein the whole lump will be removed, and so that not just samples, because in the core needle biopsy they only get samples. So I think 5 threads were taken from the cyst. He said that he wants to take the whole sample, and I was quoted with 30,000. So I got really confused at that time, because Oh my god. So it's me again. Sorry for the interrupted talk earlier because the doctor went inside to ask some questions and I was told to change to my casual attire because I will be using the hospital dress tomorrow. I will be using the hospital gown tomorrow, so I need to keep it clean. Okay, so when the second doctor told me that I need to undergo a surgical biopsy wherein, so this will be my second biopsy after the core needle biopsy. He told me that I need to, for him, he wants to confirm if it's really cancer because the previous result only mentioned of atypical features. And also, he said that it's only the diagnosis was only based on samples of the tissue. So he wants to make sure and to get the whole mass. So he is going to perform a surgical biopsy, get the whole mass and have it tested. So after that second consultation, I got really confused and also anxious because I was thinking about the additional cost because he quoted me 50,000 pesos, and I was thinking that if the core needle biopsy guided with ultrasound was actually accurate, and later on I will have the surgical biopsy, which will be the second biopsy to be conducted, and again it will be confirmed that it's cancer, then it's just like additional cost and additional pain on my part, because if confirmed that if it is really cancer, then they will still need to remove the whole breast, because I will be choosing mastectomy over lumpectomy. So lumpectomy, the doctor said if I choose lumpectomy, so it is a more complicated procedure because they will still have to, aside from removing the lump, they will have to remove the tissues surrounding the lump, and then they will perform and conduct additional tests to see if the tissues not removed, if there are still cancer cells in the tissues not removed, and if based on the results there are still some cancer cells left, then they again will remove another set of tissues. So after that there will be radiation, and the doctor told me that the radiation is almost as costly as the operation itself, so it's like double the price. And there is also the risk that cancer cells will recur in the same breast, and in that case usually it's a more aggressive type of cancer, so the cancer that will recurs could be a more aggressive type of cancer. So based on those considerations, I really preferred mastectomy because first, there will be no more need for radiation because they have already removed your breast. Second, cost-wise, it's more practical for mastectomy, but only removing one right breast. Although some people that I know had their two breasts removed because they don't want the cancer cells to recur or to transfer into the other breast. But for me, I think that would be very invasive, and I'm not yet ready to have my two breasts removed. So I prefer only the right breast, and maybe in the years to come, if there are the two masses found in the left breast would actually turn out to be cancer cells, then that would be another operation in the future. So for now, only one breast. So I was really agitated because there was already the core needle biopsy guided with ultrasound, and that was already 25,000. And then the second doctor wants another biopsy, and that's 30,000. So aside from the fact that the core needle biopsy was was already quite painful, although there was anesthesia, but after the procedure, of course, it was only a little incision, but I still felt pain, and in the how much more for the surgical biopsy, how much more for the if the whole lump would be removed. So it's a more invasive procedure for me, so more costly and more painful. And if confirmed to be cancer, then I still need to undergo mastectomy, which is the removal of the breast. Okay, so I again went to another doctor, to a third doctor, and this third doctor told me that there is no need for another biopsy if I want to have a second opinion on the results. So we are just going to get the sample from the first hospital that conducted the biopsy and submit the sample to another hospital, to another set of pathologists who will review the sample, or the sample of the mass that was taken during the biopsy. And yeah, so we submitted it. So when we submitted it, actually the result was invasive mammary carcinoma, NST, nuclear grade 1, and low grade ductal carcinoma in situ. So actually now it's really confirmed that not only do I have carcinoma in situ, but I also have invasive mammary carcinoma. So it has already started to invade. So that's for the second result. Actually, we also had this biopsy. The result was ductal carcinoma in a typical proliferative breast lesion with features of ductal carcinoma in situ and area suspicious for invasion. And the second result, or the second opinion, based on the same sample, is that the diagnosis was invasive mammary carcinoma, NST, nuclear grade 1, low grade ductal carcinoma in situ. So basically, it's not anymore stage 1. And from the oncologist that I have also consulted, so this is another oncologist, so I consulted 3 surgeons and 1 medical oncologist. So from the based on the statement of the medical oncologist, since the size of my tumor is already 2.2 centimeters, then it means that it's already stage 2 at least, and it depends upon how invasive or the extent of the invasion. So it could rise up to stage 3, and if based on the nearby organs, cancer is already scattered, then it could even rise up to stage 4. Okay, so but as of now, it's stage 2 based on the size, but could rise higher to stage 3 and even 4. Okay, and there was also this immunohistochemical staining done. So I paid 5,600 for this, and the result was negative. So it means that if it's negative, then it's not anymore hyperplasia, but it's already confirmed that it's already ductal carcinoma in situ. So here you can see immunostaining for CK56 will differentiate usual typical ductal hyperplasia from ductal carcinoma in situ. In the benign lesion, the basal cells show moderate cytoplasmic staining reaction. So if it's benign, usually it would show moderate staining reaction. So in this case, since there is no staining, it's negative. So it means that, so the pathologist concluded that it's really cancer cells. Okay, so also based from the staining, there is absence of myoepithelial cells which indicate invasion. So meaning part of the carcinoma in situ, part of it covering the myoepithelial cells was already absent, meaning the cancer cells already went out of that mass and already started invading. So this confirmed it. And then the surgeon also told me to get an ERPR test. Based on my ERPR test, I was positive I am positive for estrogen receptors in 80% of tumor cells, and I am positive for progesterone receptors in 80% of tumor cells, and weakly positive in the HER2 neo-acid test. Okay, so because my score is only 2+. So that's the history of my diagnosis for breast cancer, and which is why I am here in the hospital today. So I'm already admitted in preparation for my mastectomy operation tomorrow, and I'm really hoping that only my sentinel lymph nodes will be removed and the cancer cells is not yet spread to my auxiliary cells. So it's just a hope, but of course hoping for the best, but preparing for the worst, because even during the second opinion I was hoping that it's not really cancer cells. I had my hopes up, so it was really positive, but then it turned out it was confirmed that it's really cancer. So I was really disappointed. Because I thought that in the confirmation, when the second surgeon told me actually that there is still a chance that it's not cancer. That's why we need to have the whole cyst removed for it to be examined, because based on his experience, there are really false positives before, wherein the patient was diagnosed with cancer, but actually it turned out it was not really cancerous. So we really wanted to get the whole whole tumor, whole mass, but I don't want to waste my hopes up anymore, because I already had a second opinion by a different set of pathologists, and based on their second opinion, they really confirmed, and their second opinion is even worse than the first opinion, because they really concluded that it's invasive mammary carcinoma. So in the first biopsy result, it was just suspicious for microinvasion, but in the second opinion for the same sample taken for the same biopsy, the result was already conclusive invasive mammary carcinoma. So it's really already invasive, and you guys, I really know that it's my fault, because I have been really relaxed and took for granted, and I really thought it was just benign based on my 2021 ultrasound and mammogram result. I did not return after 6 months. I only returned after like 2 years. It's already 2023, and to think that the mass, I was able to detect that mass early 2021 or late 2020. So 2023 is already like 2 years, more than 2 years, and I just, I took it for granted because I got so busy with life and having fun, traveling and stuff, taking care of my kids and enjoying life. So, well, I don't regret enjoying life, but what I regret is that I just took things for granted. So, hopefully for those of you who have masses in the breast, you can feel lumps, and even let's say after 2 to 3 months, you have not, it has not gone away. So please have a check, because it could really spell a big difference. Like if it's still early stage, because if it's still early stage, then you could at least escape worse, escape extreme operations, extreme measures like the removal of your auxiliary lymph nodes, which I'm really scared, you guys, because I don't want my auxiliary lymph nodes to be removed, because the result where my doctor would be, there is a high probability, especially since I'm still 36 years old, and based on her previous observation, the right arm, the fluids would get trapped in your right arms because there is no more lymph nodes to control the fluids or to facilitate the flow of the fluids in your right arm. And it's like, I don't want it to be like that. If you're familiar with elephantiasis, so I'm like thinking that your right arm could bloat, or could be as big as, in the same scenario as that of an elephantiasis case. Hopefully not, but That's why I'm really praying that my axillary lymph nodes is safe and would not need to be removed. Okay, so have the removal of your sentinel lymph nodes is already very, for me, is already a big loss. The removal of your breast is really a big loss because it's still part of you. And my two kids have, I have breastfed my two kids with my breast, although my milk was not really, that abundant. But I love my breasts. They're not big, but they're cute, and I like the form of my breast. So but I'm really going to miss my breast, and it's a sacrifice. And I have already said goodbye to my right boob. And I'll just update you guys on what's going to happen. Of course, I cannot update you during my mastectomy. Hopefully, I will be asleep the whole time because I really don't want my anxiety to go up, because I'm really scared of pain, guys. Like, I've been through two pregnancies, but this is my first major operation. Okay, so I really don't know what's going to happen. I saw on YouTube how mastectomy is performed, and it was really scary. Like, I wanted to vomit after looking at it. I feel so sorry for my internal, for the fats, the skin, and it's like, oh my gosh, it's like torture, you guys. But thankfully there is an anesthesia, and I hope the anesthesiologist will also be responsible, because I've heard also of people dying or being in a vegetative state because of wrong administration of anesthesia. So throughout since January and until yesterday, I was not really feeling, I'm still feeling high, because I just have to accept the fact that I have cancer, and if I need to die, well, we cannot do anything about that, right? So there is always that possibility that we will die, and it's only up to God when we will die. Now, some people don't have cancer, but because it's already their time, they're just walking into the streets and they get hit by a car or whatever. So we don't really know when we are going to die. So I don't know, maybe having breast cancer is also a good thing, because at least you are warned that you are already near your death sentence. Not for cancer, how you wouldn't expect to be near death already, because especially me, I'm still 36, and maybe I'm still far from being a senior citizen, but at least I am already being warned. But right now that I'm already here in the hospital, I'm already being admitted, I can't help but think about the pain, because that is really my major concern. The pain from the operation, what the inconvenience, the discomfort from the operation. So I'm still thankful to God, because I have the resources to have myself get operated, and I know it's really putting a strain on our budget, but at least I have the choice to have myself operated, because I know many women out there, and it's really true, they want to do something about their lump, they want to do something about the mass in the breast, but because of the cost of the laboratory test, imagine the biopsy was 25,000, the surgical biopsy was supposed to be 30,000. That alone is so expensive. So here in the Philippines, our minimum wage is 10,000. So just think about how expensive that is for ordinary Filipinos. So I'm just so lucky that I was able to, that I can, although it's really straining on our budget, but at least I have means to look for money to support my operations. So yeah, PhilHealth, I've read, will only cover 22,000. So the quoted cost for the mastectomy is 180,000, and I'm not so sure if that includes everything or if it's only for the operation. I will just update you guys. But PhilHealth will only cover 22,000. So let's say 180 would really cover everything, including the medicine, and hospital, whatever. 22,000. So that would leave you still 158,000. So you still have 158,000 to contend to. So it's really good if you have insurance. And okay, I could, but anyway, so after this mastectomy, again, I think I will be scheduled for chemotherapy. So as of now, I don't have any idea how much that would cost, but as of now, I'm just praying that my axillary lymph nodes will be safe and won't need to be removed. And I'm just hoping that everything will be okay. And the pain, okay, that's my scariest right now. That's my really that's my palpable fear actually right now. That's my apparent fear. What is going to happen after the procedure? Like, when can I move? When can I return to my normal activities? So that's it.